Proper demonstration of assisting elderly on a shower bath. The purpose of this is to keep the patient fresh, clean, and comfortable. Prepare all the necessary equipment and supplies to facilitate smooth caring throughout the procedure. Soap, bath towel, rubber mat, and scrub towel. After preparing all the necessary equipment and supplies, check the doctor's order and proceed to the unit or room of the patient. Don't forget to knock 3 times for courtesy. Greet the patient, introduce yourself, verify the patient's name, explain the procedure, and check the adequate lighting and the room temperature. After that, do the proper hand washing to reduce the risk of spreading of the microorganisms. Before on shower bath, check first the temperature of the patient. But before that, make sure to disinfect the thermometer, using the 70% isopropyl alcohol together with the cotton balls. For disinfecting from bulb down to the stem, circular motion, and then turn on the thermometer. Place it in your patient's middle part of the underarm and wait the alarm. Remove the thermometer and make sure to read and disinfect from stem to bulb. Read it first before disinfection because alcohol has a cooling effect that may alter the accuracy of the temperature. Assess the readiness of the patient and assist the patient going to the bathroom. If the patient is able to walk, let him be. Just guide him towards. Hang in occupied or in use sign outside the door because clients need privacy while bathing. And make sure to explain to the patient and instruct the precautions for safety. Check first the water temperature, and the water temperature must be 37 to 40.5 degrees Celsius, and let your patient also check the water temperature. Assess the patient on removing cloths. Make sure to check the pocket of the clothes to check if there is any personal things before placing it in a laundry basket. Use handheld shower. Handheld shower allows caregiver to stay dry. If the patient is unable to shower independently, stay with the client at all times. Help client out of the shower because assisting client out helps prevent falls. Assist client in drying, dressing, and grooming. And after that, do the aftercare. Discard the soiled linen, place an occupied sign outside the door, and return articles to proper places. This is to maintain cleanliness and good infection control practices. Wash your hands. Do the recording and reporting. Proper demonstration of assisting elderly in a tub bath. The purpose of this is to keep the elderly clean, fresh, and comfortable. Prepare all the necessary equipment and supplies. This is to facilitate smooth caring throughout the procedure. Before entering the room, read the doctor's order and knock the door 3 times for courtesy. Greet the patient, introduce yourself, verify the patient's name, and check the adequate lighting and room temperature. Hang in occupied or in use sign outside the door. Client needs privacy while bathing. Explain the procedures and assess the readiness of the patient. And make sure to do the proper hand washing. Check first the temperature of the patient before bathing. Make sure to disinfect the thermometer using 70% isopropyl alcohol together with cotton balls. By disinfecting, do it in a circular motion and one stroke only. Assumingly that the procedure is already done, don't forget to disinfect it again, using again the 70% isopropyl alcohol together with the cotton balls. Now disinfect it from stem to bulb, circular motion in one stroke. Assist the patient going to the bathroom. If the patient is able to walk, then let him be. Just guide him towards. Assist the patient on removing the cloth. Make sure to check the cloth of the patient to check if there is any personal things before placing it in a laundry basket. And also explain or instruct the patient the precautions for safety. Check the water temperature and fill the bathtub with warm water 37 to 40.5 degrees Celsius. This is to keep the client warm to prevent chills. Explain or instruct precautions for safety. Emergency button for an emergency. Help client into the tub, providing necessary assistance. It is because falls can occur. Provide safety. Leave the patient alone during the bath, but do not leave the vicinity of the bathroom. Check on the client within 10 to 15 minutes and be alert for any silence. Prolonged exposure to warm water may result to lightheadedness or dizziness. If bath is completed, provide necessary assistance in taking the client out of the tub and sitting on the chair. And also take the bath blanket and the chair to cover his body. Draining water and assisting the client getting out of the tub help prevent falls. Now assist client with dressing and grooming. And now assist the client or patient going back to the bed. After that, do the aftercare. Return to the bathroom, clean the tub, discard soiled linens, and place an occupied sign on the door. This is to maintain cleanliness and good infection control practices. And after that, do the proper hand washing. And do the recording and reporting. Assisting elderly in changing of cloth. The purpose of this is to provide a temporary physical barrier and to keep the patient warm and comfortable. After that, prepare all the necessary equipment and supplies to facilitate smooth caring throughout the procedure. Make sure to do the proper hand washing. This is one simple activity that prevents the spread of microorganisms. And do the proper hand gloving. Read the doctor's order and bring the clean hospital gowns beside doing the procedure. But before that, entering the room, knock the door 3 times for courtesy. Approach the patient, greet the patient, introduce yourself, verify the patient, and explain the procedure. Make sure that there is an adequate lighting. Assist the patient carefully. Using the bath towel, cover the patient's body to keep it warm and avoid chilling while doing the changing of cloth. Gently take off the cloth of the patient. Look for personal items which may be pinned to the gown. Then, fold the used gown and place it on a laundry bin. They might be the cheap or common items but very valued to the patient. Now, adjust the clean gown to make the patient comfortable. Put the used bath towel in the laundry bin. Assist the patient going back on her comfortable position. Do the proper ungloving and the proper hand washing. Proper demonstration of assisting patient who is able to brush teeth. The purpose of this is to help prevent gum disease and tooth decay. Prepare all the necessary equipment and supplies to facilitate smooth carrying throughout the procedure. And wash your hands. Check the doctor's order, and before entering the room, knock 3 times for courtesy. Approach the patient, greet the patient, introduce yourself, verify the name of the patient, and explain the procedure. Place the articles or supplies on the table or a clean and dry surface. Assist the patient in a sitting position. Placing the patient in upright sitting position will prevent aspiration. Protect the patient's gown and bed with towel. Assist the patient as necessary. Offer help to rinse the mouth. If help is not needed, leave him alone. And after that, do the aftercare of all the equipment, do the ungloving, and the proper hand washing. Clean other articles and return to patient's bedside cabinet. Discard disposables. Assisting the nurse with proper preparation and administration of oral medication. Oral administration of medication is a convenient, cost-effective, and most commonly used medication route. Prepare all the necessary equipment and supplies to facilitate smooth carrying throughout the procedure. After that, do the proper hand washing and proper hand gloving. Read and check the doctor's order or the patient cardex. And make sure to properly check the label of the medicine. Arrange the medicine in a tray to avoid misplacement. Now proceed to the room of the patient. Knock the door 3 times for courtesy. Properly identify the patient base from the medication card and state your objectives. By approaching the patient, greet the patient, introduce yourself, verify the name of your patient, and explain the procedure. Give the medicine and stay with the patient until the medicine is consumed. After care of the equipment used, putting the medicine card in its proper place as well as the medicine gloss. And leave the patient comfortable. Remove the gloves and dispose it properly. After that, do the proper hand washing and document the procedures done. Giving and removing bedpan and urinals. The purpose of this is to collect the urine or feces and allow people to have a bowel movement or urinate while they are in bed. Now prepare all the necessary equipment and supplies to facilitate smooth carrying throughout the procedure. After that, do the proper hand washing. This is one simple activity that prevents the spread of microorganisms. And do the proper hand gloving. Before the procedure, read the doctor's order. And in entering the room of the patient, knock the door 3 times for courtesy. Approach the patient, greet the patient, introduce yourself, verify the patient name, and explain the procedure. Close the door, window, and screen the patient. This is to provide privacy of the patient. Place a clean blanket or clean towel on the top of the patient for privacy. Now put the patient in dorsal recumbent position and place in the bedpan. When the patient signals or once patient is done, remove the bedpan and cover the bedpan. Give to the patient the hypoallergenic wipes and any toilet tissue. And now help the patient back in a comfortable position. Remove the towel and put it in a laundry basket. And make sure to measure and discard content, clean and dry the urinal. Do the aftercare of all the equipments. Remove the gloves and dispose it properly. And after that, do the proper hand washing. Do the recording and reporting. Proper demonstration of collection of urine specimen. Urine collection helps diagnose kidney problems. Prepare all the necessary equipment and supplies to facilitate smooth carrying throughout the procedure. After that, do the proper hand washing. This is one simple activity that prevents the spread of microorganisms. And make sure to do the proper technique of hand gloving. Before doing the procedure, make sure to read the doctor's order. Before entering the unit, knock the door 3 times for courtesy. Now approach the patient, greet the patient, introduce yourself, verify the patient, and explain the procedure. Make sure that the room has an adequate lighting. Place a clean blanket or towel on the top of the patient for privacy. And put the patient in a dorsal recumbent position. And place in the bedpan. Wait until the patient is done. Now remove the bedpan or urinal and cover it. Now carry the bedpan or the urinal to the bathroom to transfer the specimen to the sterile urine bottle. And discard the remaining urine in the toilet bowl. Cover it with a tissue to secure it and do the aftercare of all the equipments. And send it to the laboratory. Remove the gloves and do the proper hand washing. Document that urine specimen has been collected.